So tell us a little bit about non-alcoholic fatty liver. You mentioned that already a little bit, but tell us about what causes that, and tell us how people are tested for it.
Yeah, so non-alcoholic fatty liver disease is on the rise. And before, what was more common, especially before this epidemic of obesity, was alcoholic fatty liver disease that eventually can cause fibrosis of the liver and cirrhosis. But with the rise in overweight, obesity, we're seeing a lot of the regular liver tissue is being switched with fatty tissue. And the longer we have that, the more that's becoming irreversible. And the tissue is becoming fibrotic, and then it eventually leads into cirrhosis of the liver, which is irreversible. And it's directly linked with abdominal weight, specifically with fructose. Fructose is the fruit carbohydrate, fruit sugar that raises the fatty liver more than glucose does. And so addressing it would be addressing the abdominal adiposity, the abdominal fat. And the diets that work really well for them are really low carb diets, as well as fasting. If we can put the body into a little bit of a ketogenic state, it really helps with reversing the fatty liver. How is it diagnosed? Diagnosis is not as easy because liver enzymes, the part of the metabolic panel, the ALT, AST, GGT, these are liver enzymes that might be high for someone that has fatty liver, but they also might be normal. Certain ethnicities are more common. We see this a lot in Asian, Indian, Middle Eastern, more than Caucasian or African background ethnicity, that they're more, usually Easterners are more prone to fatty liver at a smaller weight. Ultrasound of the liver, specifically FibroScan, specifically measures the fatty and gives us a staging system for it. Liver MRI also is another way, and liver biopsy in extreme cases if we're trying to see the stage or if someone has fibrosis or cirrhosis or not. But as a general rule, if someone is overweight or obese, even if the numbers are normal, we assume there's some type of a non-alcoholic liver disease. Now the term is no longer non-alcoholic, it's metabolic associated. So it's a MASH rather than NASH. And MAFLD, metabolic associated fatty liver disease rather than non-alcoholic fatty liver disease.